I had talked about perimenopause in one of my last videos, and I just wanted to kind of continue that discussion because it's so needed. I didn't realize until I started going through the change how much, how lack of information it seemed to be out there, or even lack of support, and even from medical professionals. I am not by any way putting down medical professionals because I'm in that group as well. I'm a family nurse practitioner. Um, I'm in the medical field as well. I've been a nurse for 20 years. Um, I'm just going off of my own experience. Like I said in the last video, I absolutely thought I was losing my mind. I was having all kind of symptoms. And every time I would go to the doctor, they didn't find anything. And it's kind of weird because I wasn't really disappointed that they didn't find anything. I mean, of course, that's a good thing, but I was disappointed that I knew something was different and that they weren't finding anything. And so we all know if there is no problem, then how can there be a solution, basically? So, just to kind of go over some of the symptoms you can experience, and I may not hit all of them. Um, and I'm gonna kind of go from head to toe so that it kind of helps me kind of think it through. You can have migraines. You can have something called brain fog. If you don't know what that is, it's basically like forgetfulness. Or like for me, I am not kidding. I will be holding a spoon and trying to think of the name of it. And I know in my head it's a spoon, but I just cannot think of the name spoon. That's happened more than once. Um, and it get kind of scary, you're like, oh my God, am I getting dementia or what? Excuse me. And you can have sinus, you can start getting a lot of infections because your immune system is kind of beat. So you can start getting sinus infections, you can get urinary tract infections. Um, you can have a lot of, it's like your allergies can increase. You start having a lot of sensitivities to certain foods that maybe you used to be able to tolerate and now you cannot tolerate them. You can have a lot of GI issues. Um, for me, I started having problems with irritable bowel syndrome. If you don't know what that is, it's like one minute, I know for me, my bowel, it slows down or get very sluggish and I can get constipated for days. And it's not even like, it's not painful constipation. It's just that you don't go for like 3 or 4 days or you just go a little bit. And then for me, it's followed by maybe a couple of days of like very loose stools. Um, but you kind of never empty out completely. And so I was having a lot of gut issues and I saw a GI specialist for it because I didn't know what was going on and that's what was determined. Um, you can also get a lot of, I feel like because of the sluggishness in your bowel, then I started having problems with heartburn as well. And that's a big one. And one of the things that you can get with going through the change perimenopause or menopause. You can have urinary tract problems. You can get frequent urinary tract infections, or you can get kind of what they call kind of genital urinary symptoms, where you have like a burning sensation down there, where you feel pressure, or you're not emptying out your urine completely, or you can even develop problems with urinary incontinence or dribbling. So you may not necessarily completely pee your pants, but you have a hard time um, making it to the bathroom when you really have to go. I mean, I'm embarrassed to say, but hey, I'm an open book here. I have peed my pants before. One time, the first time it happened, I was at work and I had waited kind of long to go. You know how you're trying to finish something and you kind of feel the urge, but I had to go really bad. But usually you can just tighten up your muscles, right, and wait until you get to the bathroom. I literally every step that I took, it was like the Bobby Brown song, "Every little step I take." That's exactly how it was. Every little step I took, I was dribbling to the point where I ended up having, thank God I worked in Danville. I had to go home and shower and change my clothes. And so that was just the beginning of things. You can have very painful periods. Your periods can all of a sudden get irregular, and that's because your hormone levels are changing. Um, Golly, you can start having fibrocystic breasts, problems with your breasts. Um, you can have body aches and pains in your joints in weird places. I started having um, every once in a while, I'll get almost like a electric type of feeling in my right ankle. And it's weird. It's like I just wake up and start walking on it and it hurt. So when you see those funny little TikTok videos when people get out of bed and they stretch and then they pull something, yeah, that really can happen, especially during menopause. Um, Sometimes your eyesight can even change. I have never in my life had to wear glasses until I was 40. Yeah, just one day I was driving home and I noticed that the sign seemed blurry, and I thought that I was just really tired. I'm like, man, I must really be tired. And it happened for like weeks. And honestly, I didn't think anything of it because I could see pretty well through the day. But it was mainly at nighttime. And then it was until I had a work physical and they did an eye exam when it was determined that no, I needed glasses, especially at night. And now it has progressed to I need glasses pretty regularly. So you can have inner ear problems. You can start having problems with um, tinnitus. I like to call it tinnitus, whatever you want to call it, where you have that ringing in your ear, some time of fullness in your ear. You can have weight gain. That's a big one that a lot of us can relate to. As your levels begin to drop, you begin to gain weight. Um, you can start having problems with your blood pressure, hypertension. Your cholesterol can increase because estrogen is very protective to the woman. It wants to protect us so we can bear children and bring forward children. That's just kind of the cycles of life. And as that begin to decline, then our risk of cardiovascular disease goes up, putting us at risk of strokes, heart attacks, um, certain cancers. I'm just trying to think. It's just so many things that can happen. Oh, and I cannot forget about mental health. How you begin to have problems with like your nervous system get overloaded. So you begin to have problems with anxiety and depression. Um, and because of that, you can also, like for me, I had an intolerance to stress. So like the things that used to cause stress, I feel like it used to just roll off. I used to be able to just pick up and go. I mean, I still handle it okay, I guess, but I noticed that I began to have a lot of palpitations and anxiety. I had panic attacks and was feeling depressed. And I was having problems with insomnia. I was only sleeping so many hours a night. I would be extremely tired, like 9 o'clock, but then I would be up at 2, 3 in the morning and couldn't go back to sleep. And that's all a vicious cycle because what happens is as you're not getting enough sleep, then your cortisol level go up, which also make you gain weight. It was just all a vicious cycle. You can also have fatigue where you're extremely tired. So can you imagine that you're extremely tired? However, you have insomnia as well. So, and we cannot forget about the inevitable night sweats and hot flashes. Now, for me, hot flashes was also associated with a panic attack. So I would feel very hot and then I would feel panicked. And then that was followed by um, palpitations. And then sometimes the feeling of feeling faint, like I'm going to pass out. So you can also have that as well. So it is a lot of things. So if you're having any of those things, and it can be other things, I'm not saying it's always perimenopause or menopause, but it's a good chance that if you are in that age group of 35 or up, it could be. So let's continue to talk about this. God bless.